symptoms, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Good morning, good morning, good morning, good morning. Glorious good morning on this sunny 8th of August 2026. My name is Ayo Olatoye. I'm going to be your host today. I'm many things, but one of the things I do is I'm a acute medicine consultant, and it's my honor to be on the Black Health Hour today. Now, we don't often get weather like this, do we? So let's celebrate it. So again, it's sunny where I am. I think where are we? We have 21 degrees. So why don't you put in the chat where you are? Is it sunny? Is it not sunny? Do you have any plans for today? I've got to do some things with my family and my son later. So what's everybody doing? How are you spending your sunny Saturday in August? Where are you? Let me know. Let me know where I want you to, again, just engage. We've got Leicester. It's bright and sunny. Wonderful. Where is everybody listening and watching from? Put it in the chat. Let us know. I'm in Manchester. Okay, we've got somebody in Salford. Looking forward to going to the gym later. Beautiful sunshine. Plan to do some housework and then relax in Hertfordshire. Lovely. 24 degrees. Nice. With my mum in London. Good morning, Mummy. Thank you so much for joining you. It is my honor to host today. I am grateful for the opportunity to be involved in the Khan Black Health Hour because it's for us, by us, and it's important for us to have conversations about these things that pertain to us and by people who look like us, rather. Oh, we've got another one. It's beautiful East Africa. I think Burundi, to be specific. We're all very jealous. So we have, one of the things I really admire about the Khan Black Health Hour is the caliber of the people we have that we get to speak. Today we have somebody I can call a friend. Dr. Folake is a clinical lead GP. She helps people create freedom with a travel business. She's involved in clinical practice and entrepreneurial thinking and strategic thinking. Alongside her clinical work, she's a travel concierge specializing in exceptional holidays. So if you find out what her details are, you want to go somewhere else and enjoy something like this somewhere else, then get in touch with Dr. Folake. She'll be able to help you. And she'll be able to tell you about your headache and your chest pain and your abdominal pain as well on the way. She also mentors fellow medics and professionals building flexible businesses. So not only is she good at clinical stuff, she's good at helping people think differently. Today, we're going to have a fantastic session. It's about gut health and digestive wellness. Something that she might talk about is people, have you ever heard the phrase, the gut is the second brain? The gut is the place that has the second most dense amount of neurons compared to the brain. So I'm looking forward to this session today. Dr. Folake, thank you for your time. Please take it away.
Thank you, Dr. Ayos. That is such a humbling introduction. Thank you so much for those kind words. And good morning, everybody. It's lovely to be here with you. And as Dr. Ayos said, it's always a pleasure to spend some time here with our people, my people, because you know what, nobody's going to look after us outside ourselves. And it's not because people don't want to, they just don't understand what our challenges are, what we need, what the extra social impact on our health is, and they can try and empathize if they choose to, but they can't understand. We are the only ones that can understand it. It's such an honor to be here today, and it's also beautiful. These days we have so many Black healthcare professionals in so many different niches in the NHS. So Khan is doing a great job to bring us all together, to bring all that expertise and knowledge to be able to help us ourselves, really. So without much ado, I'm going to start to share my slides because gut health is something that as a GP, I see a lot, and it's one of those things that can be vague, nothing, or it can be something serious. But whichever one, it's always a distress to people because it's about eating, about, it's something that we can see quite obviously when we have problems with our digestive system. So I envisage that we're going to have quite a lot of questions. So I've made the slides very simple so that it's easy to understand, easy to follow. I'm trying not to get too medical on there, but if we have anything, if the flavor is to ask more medical inclined questions, I'm happy to go into that as well. So just let me know, can you see my slides, please? Yeah, good. Thank you. So let's get started. So I've gone through the different parts of the digestive tract here. It's just a bit of a reminder of our science and our biology for anybody that might have forgotten about what it actually looks like with the digestive tract. And it starts from the mouth and goes all the way down and ends in the anus. And I'm going to go through all the different parts in the slides that are coming. So the mouth is the start. We sometimes we forget about it, and even in the medical parlance as well. The medics deal with everything from throat downwards. The dentist or the head and neck team deal with the throat and the mouth. So it's a bit delineated, but we can't forget that it starts with the mouth because we start to chew and break down the food in the mouth. And we also have enzymes in the mouth. I don't know if you can see my slide there, from the salivary duct that help us to digest the food. And people that have problems with the salivary gland, so that produces the saliva, have problems with digesting the food. The mouth is dry, it's sore, they can't swallow, they can't chew and, moisturize the food properly, they have problems as well. So it's a very important gland that we're dealing with here. So the chewing starts from the mouth. Some of the food products start to get broken down, especially the carbohydrates. So we've got enzymes in the salivary gland that starts to break down the carbohydrates as well, starting from the chewing. Now, when you can't chew properly, it causes a lot of problems because you can't break down the food, your mouth is sore, you can't eat well, so it leads to malnourishment. And we see that a lot in our, middle-aged elderly people where they have poor dentition, where they then have to go and use artificial teeth because they can't chew well. And some people actually start to lose weight and they start to look very emaciated just because they can't chew. So it's a very, very important step in the digestive tract. And I always just want to remind people not to forget that is also quite important. The other thing that affects at the mouth level is eating too quickly. So some of us do that. We're eating very quickly because we've got really, really busy lives. Again, it comes with sometimes our demographics as well. We're trying to do so many different things just to make ends meet and build that financial, stability for ourselves. So we don't have time to actually sit down and eat properly, and we're eating very quickly. Not drinking enough water as well, obviously that would affect your food because the food is too thick, you can't swallow well. Again, that also affects it. Hot and spicy food, yes, spicy food, I've got a special slide for that for my fellow Nigerians, and I don't know which other African country eats spicy food. I know Nigerians do. I don't think the East Africans and the South Africans eat as much spice as we do, but I'm not going to start that debate today. Smoking in itself, it's mainly the effect in the mouth is what the smoking comes. It affects the dentition. It causes problems in the mouth like thrush, ulcers, and of course we've got the cancers as well. So that's why I've listed smoking on the slide as well. So these are the problems that we can have in the mouth. I've started their cancers. Now, cancers can happen everywhere, and I'm not going to mention it at every stage because it's just going to become scary and boring. So I've just asterisk cancer there. Just bear in mind that we can have cancer in any part of the body, really. So this is the summary of what happens in the mouth. So it starts with the chewing. We have the problems we can have in the mouth, as well, from eating too quickly, and obviously the disease that we can have as well in the mouth. So from after the mouth, the food goes down the esophagus. So that's what we call the food pipe. So that's what connects the mouth to the stomach. And again, the problems from the mouth can then transfer to the esophagus. So if you've not chewed well, what happens is the food goes in, it's not well broken down, it's uncomfortable, it's painful to swallow, and you don't quite enjoy the food. And sometimes you're clutching at your chest as well because you've eaten too quickly or you've not had enough water. The other things that can happen is acid problems. So when you have acid problems, you can call what we call acid reflux. So where the acid that is supposed to stay in the stomach comes up into the esophagus, the food pipe, and it gives you that what we call heartburn. So that's where your heartburn comes from, is that acid reflux that comes. Sometimes it also causes persistent coughing. So you get some people where they're just coughing and it's this tickly cough that they get. A lot of times is at night when they're lying down, because if you can imagine when you lie down, things are more likely to come up, and it's just there, it's just persistent. And that can easily be sorted out by using medications to calm down the acid. I haven't added there what we call hiatus hernia. So hernia again is the stomach pulls up a little bit, and then you have some bits of the stomach in the chest cavity. Again, that makes you more likely to get reflux. We've got what we call motility issues. So motility is really the movement of the muscles of the food pipe. So the way the food goes down is when you swallow, the muscles gradually contract, and it pushes the food gradually down the food pipe until it gets into the stomach. Now, people have problems with that motility. Either the motility is not as good, so the food is staying longer than it needs to do in the throat, or the motility doesn't happen at all. So that happens when you have chronic inflammation in the food pipe and the food is not going at all. These can be quite serious problems, and for anybody that is having problems with swallowing, either it's uncomfortable, it feels like you've got this constant lump in your throat, that is a serious problem, and that needs to be checked out with your GP, who will refer you for a camera test. Then we go to the stomach. So we've had the food in the throat, and then it goes to the stomach. This is where a good amount of digestion happens in the stomach. The food stays here for quite a few hours. The acid starts to act on the food, starts to break it down. It starts to churn the food around, mixing it up with all this acid, and gradually creating that sludge that moves on to the next part of the digestive tract. Now, when we eat food that have high fat content, it means that the food stays longer in the stomach. So if you can imagine, if the food stays longer, what then does that mean is that there's more gastric acid exposure there. So this is where we get indigestion. So that indigestion we talk about is when the food just sits in the stomach and it's not moving. High fat content is one of the reasons, because fat is a very complex compound. It takes a longer time for it to break down. It starts to break down there, and then it moves into the next part where it even takes even more digestion to happen. Another time we have is when we dump food in the stomach. So when we eat large quantities of food, which means that again, you need more acid to digest the food. It stays longer in there, or maybe you can't even digest it properly because there's just too much for it to do. It's just like when we're blending, when we're using our blenders to blend and we've put too much inside it. What happens? The rotor doesn't move. It can't blend that food properly. That is exactly what happens in the stomach. When we put too much inside the stomach, when we eat too quickly, the stomach is not able to work as efficiently as it should. And obviously acidic food as well, again, adds the acid, because we already got stomach acid. So people that are more likely to have acid related problem will have extra problems there. Spicy food as well, again, creates that inflammation in the stomach. So you get things you get is tummy pain, indigestion, cramps, bloating. Those kind of things are the things we start to get with this at the level of the stomach. When the stomach really cannot work as well, you start to get things like vomiting. So the food comes back, because it cannot go south. It will start to come back north, because the body's like, look, I'm not sure what you want me to do here, but you know what? There you go. So it comes back the other way. Other things we can have here are ulcers. So you can get gastric ulcers. Again, it could be because of the irritation from the acid. We also have a Helicobacter infection. I don't know if anybody has heard of that before. So Helicobacter pylori is an organism, it's a bacteria that can affect the stomach, and it gives you kind of acid type of problems. So you find that when you see your GP and you're complaining of acid problems, depends on your GP. They might start with treating you with medications to calm the acid down, or they might choose to send off a poo sample or a blood test to see if you have this infection. Because if you have the infection, no matter how much acid tablets you use, it's not going to sort it out. To sort it out temporarily, it's going to come back. You need to clear that infection. How do you get that infection? Is usually through food. Food is the main thing. So Helicobacter pylori infection is very, very common in African countries, just by the fact that it's transmitted through food. But it's also possible to get in the UK as well. Again, it doesn't really matter if you're African or Caucasian. I've seen both parties having Helicobacter infection. I mentioned hiatus hernia in the last slide. I've put it on here so because it's mainly a stomach problem, not a throat problem. I think I've talked. Obviously, you've got gastric cancers as well that you can have. And then when you then go down from the stomach, you come to this C-shaped pinkish part, which is the start of the small intestine. But what happens here is so important. So we've got the liver, spleen, and gallbladder complex. They're very, very important organs in the digestion process. So the liver is quite important in taking out toxins, harmful substances from the food that we've eaten. So the liver is working overtime to make sure nothing harmful is getting past, into our system. The gallbladder that sits below it, so that's the green part there, it produces bile. So the bile is what digests your fat. So remember I mentioned the fat in the first part. So the gallbladder produces the bile that helps the fat to then get absorbed. And then you've got the pancreas, which is this yellow bubbly bit. Again, that one also helps with digestion of, it gives you the amylase, so it helps with the carbohydrate digestion. But quite importantly, it also is the one that secretes the insulin. So when people have diabetes and have problems, it's from the pancreas. Now, these organs are so important and they can easily get harmed by anything that is toxic. Most commonly, we've got alcohol. Alcohol is our number one in this country, and it's also happens in Black people as well. It happens in white people, it happens in Asians, but alcohol is the number one toxin that affects these two glands, the liver and the pancreas. And once they get inflamed, they can cause a lot of problems for people. Liver failure, liver inflammation, hepatitis, and pancreatitis, so pancreatic inflammation, can really, really affect your well-being. If you think that they are the ones that deal with the toxins, they produce most of the enzymes that give you the digestion. So once they're not working well, we're in trouble, literally. Like you can't survive with them when they're not working well. Other things that can affect them are viral infections. So I'm sure you've heard of hepatitis. So we've got 5 types of hepatitis A to E. A and E are from food sources, so you get them from food sources. B and C is the one you get from blood, from sexual contact, as well. So those are the B and C. D is the mildest one to get. It usually comes up with other ones. It doesn't really give you that much problem. A and E most times, because they're through food, they're there for a few days, they settle down. You're unlikely to do a blood test. By the time you do the blood test, you probably will not catch the A and E anymore, because most viral infections are self-limiting. However, if it's a serious infection, obviously, then you can get very bad hepatitis from that. There are also other viruses that I'm not going to bore you with that could also occur as well, that can give you problems with the liver and the pancreas as well. Medications is a big one, and that will be medications you buy from the chemist, medications we prescribe as well. Paracetamol, funnily, is one of the things that gives you liver problems. So we just need to be careful about what we're using, making sure we're using the right things for the right problems. Herbal remedies, our holistic practitioners will be aware that a lot of herbal remedies can be toxic as well. If not taken in the right dose and the right proportion, you can then have problems with the liver and the pancreas. We have this little knobbly one here, which is called the spleen. Now, the spleen is one of our immune glands, so it helps with the immunity generally. So it's not really involved in direct digestion per se. However, problems that affect the liver can have a knock-on effect on the spleen. So as medics, when we do investigations, sometimes you do have an ultrasound, you see that the liver is big, the spleen is also big, because they're again in the same complex. But the spleen mainly is for immunity, so it helps with your immune system generally. So I've talked of things that can give you problems. So the medications, drugs, and viruses, and I've talked of the diseases, most of the diseases you can get. Obviously, diabetes is not a gastric problem, but it's very important with the pancreas, because if the pancreas gets inflamed, it stops working, you will then get acquired secondary diabetes as a result of it, because your body is not going to be able to give you any insulin. So we just need to be careful about what we're eating and what we're putting into our system. It's not only about it going through the system, but what effect it can have on these organs as well. So if we're not eating the right things, we can see how we can easily then affect all the systems and stops them from working properly. So we're now at the small intestine. So this is just a very long loop of tissue, where it's obviously like a pipe. And food then goes through it, and it gradually goes down. And as it goes down, all the enzymes that is picked up along the way, the ones from the bile, the ones from the pancreas, they're then gradually breaking it down, and it's going down this loop, and the body is absorbing the things it needs, and it's leaving the things that it doesn't leave as it goes. So it's just gradually just making its way, and it's just doing its thing. What does not help with the small intestine is when you don't have good fiber in your diet, because what happens is it's all sludgy, it's all pasty, it doesn't allow it to move quite well. Spices as well affect it. So spices means that it goes quite quickly. So when you're going down this, the muscles are contracting and it's pushing it along. What the spices do, because it's inflammatory, it moves quite quicker. So what would that mean is that the body doesn't have enough time to absorb the nutrients that it needs to, because everything is going too quickly for it to be able to do its work properly. One of the very common things that you get at the level of the small intestine is irritable bowel. I'm sure almost everybody knows about irritable bowel syndrome, and it's what we call a functional problem. So there's no test that can tell you've got irritable bowel that we have available yet in the market. But it's what we call a diagnosis of exclusion. So we have to exclude everything out and say, okay, it's not this, you most likely have irritable bowel syndrome. And that's when the body does not quite regulate how quickly or how slowly to move the food along the intestine. So that's what the irritable bowel is. So you can have irritable bowel where it goes too quickly, so irritable bowel with diarrhea. So it's going very quickly, you're having diarrhea. Or it goes too slowly and you get constipation, or it just fluxes between both of them because the body just cannot regulate which way to go with that. We also have ulcer. So I know we've all heard about gastric ulcer, but we also have duodenal ulcer, and that happens right at the beginning of the small intestine. So if you remember that at the stomach, you've got the acid. So the very first part of the body that gets in contact with that acidic food is that beginning of the small intestine, before the body starts to neutralize it and breaks all those other things down. So you're quite prone to getting duodenal ulcer at that stage. Duodenal ulcer is one of those that it's usually the nighttime one, because this is when there's things are quite settling. There's nothing else left in the system. But it doesn't really matter what time of the day you get it. As long as you have an ulcer, it needs to be treated, and the treatment is the same for both of them. And then you've got the large intestine. So we've moved all the way down. So this is where, at this point, is where it connects with the large intestine. And we've got, at this point is where you've got your appendix. So we've all heard about appendicitis before. So your appendix is there. The jury's out as to what the function of the appendix is. I don't think we quite know what it is that the appendix does, but it's there. Some people think it's an organ that has become redundant. Some people think it has some immune properties in the body. We really don't know, but it's there and it causes problem. Now, why does it get problem? When things get stuck in it, when it gets inflamed, when it gets infected, then we have problems with the appendix. But as we go into the large intestine, this is where the stool, as we know it, starts to form. Yeah, so it gets the main function here is to thicken and to form the stool as we know it. We've also got bacteria in here that that starts to act on the food as well and helps us break down some of those more complex fiber. So a lot of the fiber gets broken down here. Now, for people who have tried healthy eating before and you go and you start eating all this, really call them cruciferous vegetables, so like the cabbages and those kind of complex ones, you find that you get a bit bloating because of the amount of gas that is being produced by those bacteria that is breaking down that fiber. So you get a lot of bloating. You can get a lot of bloating here. Obviously, this is where you get constipation as well when the food that is coming through or now is becoming poo stays longer than it should in this area. So if the stool stays longer than it should in this area, or you're not drinking enough water, or you're not having enough fiber, you have problems here with constipation. Other things you have here are what we call diverticulitis. So this is a problem that is common in more elderly populations, so probably in your late 50s, 60s and above, where you have weakening of the walls of the large intestine, and then you have like small balloons within it. So what then happens is food gets stuck in it and it causes inflammation and then it causes infection. So it's very, very, very common thing that we see in the GP land and in the A&E as well. So that is, we've got one more part, sorry, the anus. This is the exit. So this is where your food, your poo comes out from the digestive tract. And you do have problems here as well. So you can get hemorrhoids. Hemorrhoids, we call them piles. And hemorrhoids, a lot of times because you've got hard stool. So what hemorrhoids essentially is, around the anus, you have a lot of blood vessels, right? So it's like a sponge of blood vessels. What happens when you have hard stool coming? It presses on that blood vessel, and what you see outside is the pile, is like a balloon. You know, when kids are playing with balloons and you put water in balloons and you extend it. That's exactly what you see. You have that bubbly thing, which is essentially the blood vessels, because of the pressure from the inside. So hard stools are a very common cause of piles. Prolonged sitting as well. So unfortunately, the kind of work we do, we're all sitting down all the time. There's not enough circulation going on around there. You get more predisposed to piles. Piles is also very common in pregnant women. For the same reason, the baby's head is pressing on the blood vessels in that area, and everything is all engorged and it balloons out. The other thing you get in that area is what we call anal fissure. So this is a tear, a very tiny tear on the skin layer at the anus. Most commonly, again, is due to hard stools. So when people have had constipation, you do get those tears that happens. It heals by itself. Sometimes you need medications to help you. It doesn't help it to heal. It helps to numb the pain, because it's a very, very painful thing to have, because apart from the blood vessels you have in that area, you also have a lot of nerves in that area. So when it gets bruised, it is very, very painful. So what then happens is, because it's painful, you don't want to go. When you don't go, what happens? You get more constipated and it becomes harder to go. So you want to really break that cycle. So we will give you a combination of a numbing cream to put in that area, or a numbing tablet to put in that area, so it's not painful for you to go, and then have some laxatives as well to soften your stools. And obviously, it's the lifestyle about moving more, drinking more water to ensure that you have the normal consistency of stool. I have put on here what we call the Bristol stool chart. Sorry for the gory images, and I hope nobody's having a late breakfast. But we really want the middle one. This is what the normal agreed consistency is, the type 3 to 4 stools. When you start having type 2 stools, that's the beginning of constipation. And then the height of constipation is where you have what we call the pellet-like stools. It looks like pebbles or stones. That is the height of constipation. And obviously, if it doesn't come out at all, then we need to help you evacuate it. And on the other side, you have, softer stools, and then up until the type 7 stools, which are loose stools. So how can we help our digestive tract just generally? And I think this is advice that a lot of us have heard in some way or the other. And they're just a combination of things that can help with the digestion, making sure you have a balanced diet and having that fiber. We've heard that the fiber is good for the movement of food along the digestive tract. So if you think of the fiber as, it kind of helps to bind the stool. So it's not sticking to surfaces. It comes out in one nice smooth lump. And that's what the fiber does. So you go and it's easier. Water, making sure you have enough water, because if you don't have water, the body cannot do what it needs to do. Now, they do say 1.5 to 2 liters a day, but it depends on the weather. And the weather we had in the last few weeks, 2 liters a day really wouldn't cut it. You probably need more than that. But this is for the UK as well. So if you're in warmer countries, like my sister is who is in East Africa, you probably need to be drinking more than 2 liters of water any day. Now, processed foods, again, they lack fiber, and I think that's the main thing. They lack a lot of the fiber that is in there, so that you don't have that combination of food in the food that helps your food to move. Apart from the fact that obviously they have a lot of chemicals in there which can give you intolerances, and you don't get the nutrients that you need as well because of the processing of those food. But you want to limit them. And I'm not going to sit down here and say don't eat processed food, because nowadays it's so hard to just eat, natural food all the time, but we want to limit it to the minimum possible that we can. Obviously avoiding added sugars as well, because we know what sugar does is the added extra sugar giving us things like obesity, which we can't afford to have as Black people. And there's some studies to show that fermented food are quite beneficial as well, because it helps those gut microorganisms. So fermented food, you're looking at some yogurt. So kefir is one of the fermented food. I tried to find proven fermented food with African foods, and I couldn't really pinpoint the ones that I can suggest. That's my limit as a doctor. I think a dietitian will probably have been helpful in that way. But at least kefir is in all the shops, and it does help with the microorganisms in the system. Now, spicy food, I said I have a slide about spicy food. We need to be careful about how much spicy food we have, because it has its own effect on the stomach. Now, spicy food. So what is it about spicy food? So spicy food has something we call capsaicin. So that's the chemical, really. That's the chemical in the chilies or spice that gives us that effect, that kick that we're looking for. And it binds to receptors, and it gives you that burning sensation, that inflammatory sensation. And depends on how you perceive it or how you like it. It could be either pleasurable or it could be painful, depending on where you are in your spice tolerance level. But what does spice do to us? So spice give us more acid reflux, because it's inflammatory. So it causes inflammation in the stomach, and the acid, obviously you've already got the acid there, so you have more acid reflux. But it also relaxes the muscle because of the inflammatory properties. So you have more likelihood of having acid reflux and heartburn. You also have diarrhea as well, because of this inflammation, the body is like, we need to move this thing really quickly. So the body tries to move it on as quickly as it can. It doesn't get broken down, the capsaicin, as well in the system. So when it's coming out of the anus, it gives you that burning sensation. So you might then find that for us adults, or for people that have grown up in countries where you've eaten spice, your receptors are probably numb now and they don't have any problem. But we might find that our kids are not able to eat the same meals as we can, because they can't tolerate those spice. And it's important for us to acknowledge that and not force them to, because they're not enjoying the food. And what that does is they start averting the food, have aversion to food, and they're not eating the right things as well. Now, from the studies I looked at online, there's no proof that the capsaicin harms the gut biome. And I'm going to talk about the gut biome in the next slide, and you see why I keep talking about the gut biome. So it doesn't affect that, but it makes the food move very quickly. In terms of cancers, there's some suggestion. So there's some associations. It's not a direct link that has been proven, but there's an association between a high level of spice intake and cancers in the gut, mostly the gastric cancer, stomach cancer. Now, there's no one study that has proven this. There's just been studies looking at different aspects. So there needs to be more work really to see what kind of cancers, what level of spice are we talking about, what form of capsaicin are we talking about as well, because it occurs in different kinds of chilies as well. So there needs to be more studies to this, but just to make us aware that there might be some association there. We just need to be a bit more mindful in terms of the amount of spice that we're having in our food. Now, how do we achieve well-being through the gut? So there are a few things that we can do which connects well-being to the gut. The first thing is mindful eating. So I mentioned earlier, we're always so busy. We eat on the go. More common in London. When I go to London, I just find it interesting. People are just walking and they're eating because they have to catch one train and have to go to one job to make ends meet. Less common outside London, but it still happens. And we just have to be aware that when you're not mindful with your eating, your body is not having that time to actually enjoy the food and is unlikely to actually stay in and do what it needs to do for us. So just being, having that extra protected time to say, look, this is my time to eat. I'm just going to sit down and eat. Even if it's just one meal a day, if you make that breakfast, if you make that dinner, at least you're actually eating. So eating is not a stressful thing. It's something you actually enjoy because you don't want to stress your body because you're eating. Communal meals as well, that creates that connection. There have been studies to show that when people eat together, there is more bonding, there's more happy hormones as well that gets released, and people enjoy their food. And funnily, people don't eat as much as they would eat when they're eating on by themselves. That's an interesting one. And when we share food, we don't eat as much as we would because I think we just enjoy it better. So our satiety of the food is earlier because we're just having a nice time. And of all the things we say, oh, Black and Afro-Caribbean and stuff, this is one thing we actually do quite well. Communal eating and connection, we're very good at that. Having that, going to family gatherings or faith gatherings and stuff and just eating together. And we shouldn't lose that. That's something that we should keep and we should cherish as well. Food with our families as well. When we've got family, when we're living with our family, be it partner, kids, parents, grandparents, maybe just finding one meal a week at least, just for you all to sit together to create that bonding as a family, and it changes a lot. And in terms of the family dynamics. Now, the gut-brain axis. So this is an interesting one. So medicine, we've always known that there has been a connection. There's a connection between the brain and the gut. So going from the brain to the gut, because when we're stressed, what are the things we get? We get diarrhea, isn't it? We get stomach cramps. We get butterflies in our stomach. That's how we describe it. We get bloated. So we kind of knew that, all along that, yeah, there's some nerves, we call them the vagus nerve, the parasympathetic nervous system that connects the brain to the gut. But what we didn't realize is it does go the other way as well. So what is happening in the gut also then goes back to feedback to the brain. And that's very important because sometimes what we eat can actually affect our mood and how happy we are and how we function. And that as well then feeds back to our well-being. So when we have low level of gut biome, I've been talking about gut biome. When we have low level of gut biome, it has been found to actually link back to low mood. So the gut biomes are there to break down the food. You have them more in the large intestine, not so much in the small intestine. You don't expect them to be large. In fact, there's a medical condition called small intestine bacterial overload, when you have too much bacteria in the small intestine and they have to give you the clearance for that. However, you have much more in the large intestine, and it's found that there's some certain chemicals that gets released and goes back to the gut. When it's low, then we have low mood as well. So it's something to watch out for. So having those gut biomes, keeping them happy, keeping them there, does help our mood as well. Physical activity, we always, every medical person, if you don't know anything about medicine, we always talk about physical activity, but it's not because we just like to bang on about it and make you feel bad for not being active. It's because it has an effect on your well-being. It has an effect on every part of your body. Now, what the physical activity helps with in the digestion is helps you to digest better. You see that when people are physically active, there's some people who suffer with bloating and constipation, bowel issues, and they'll tell you, when I go for a run or when I go and do my exercise, my gut moves better. I'm able to get that gas out, and I feel much better. And that's because your digestion is just better. Your body is being more effective. Generally, you have better blood supply. Things and things you're eating are then being absorbed, and then they can then do what they need to do. It also means you're breaking down stuff, so they're not getting stored in your body and causing problem. And your sleep pattern as well is quite important. So your sleep pattern also affects your gut. So when you don't have good sleep, what again, that's that gut-brain axis as well. When you're not having enough sleep, your digestive system is not working well. You're not absorbing what you need to absorb. You're not it's not functioning the way it needs to. Most of the time it will slow down. Sometimes it will go faster. Now, going back to physical activity, one thing I forgot to mention when I was talking about the liver is the new pandemic in metabolic problems is the non-alcoholic fatty liver. So before we had, it was alcohol, what damages the liver, alcohol is the first thing that everybody thinks about. But now we have non-alcoholic fatty liver disease. So this is where we're having a lot of fat deposit in the liver. So the fat is depositing in lots of other places in the brain, causing dementia, in the heart, giving you strokes and it's giving you a heart attack, in the brain, giving you stroke and dementia. But it's also deposited in the liver. If you're not physically active, that's what happens. So instead of your body to break down that fat when the bowel comes, what happens is it goes back and settles in the liver. Over time, when you have a lot of fat in the liver, it starts to cause liver damage. So something as simple as fat in the liver can also give you liver damage and problems down the line. This is where your physical activity comes. It helps your brain know that, look, we're not keeping all this calories, we're burning them and we're getting them out of the system, or we're using them up for that physical activity. And that's very important. Fatty liver disease, there's no treatment for it. It is physical activity. That's all you need to do to get rid of fatty liver. Bloating. I just made a slide specifically for bloating because it's one of the common symptoms that people will come with, and because it's very vague, should I be worried about bloating? Should I not be worried about bloating? We don't know, and it makes us very uncomfortable, and it's one of those that can just be a nuisance, but nothing else is going on underlying. And what causes the bloating is essentially you have too much gas in the gut, especially in the intestine, the big intestine, and it makes us feel uncomfortable. We get these cramps, we get our stomach looks swollen, and then we just feel tired and we can't do what we need to do. It's good when you fart because then you're getting rid of that gas, but sometimes you can't even fart to get it out. So what causes bloating? The common causes are taking in air. So when we're talking, when we're eating, chewing gum as well, not closing our mouth when we're chewing, those kind of things allow us to swallow more air and it can get trapped in the system. Fizzy drinks is another one. As you can imagine, we're taking in gas. So obviously that gas then stays in and then goes down to cause problems later down the line. And I mentioned the cruciferous vegetables, but you've also got the legumes as well. So that's your beans family and onions. They're very well known to cause bloating. Intolerances also give you bloating, lactose intolerance. So what lactose intolerance is your body. So inside the milk, you've got the protein and you've got the sugar. The sugar is the lactose. So you need an enzyme called the lactase to break down the sugar, that lactose, and then digest it. Now, people who have lactose intolerance have problem with that lactase enzyme, and that sugar just stays in there. So sugar, if we remember, for those that did biology, osmosis, it pulls in things into the system. It keeps water in, it keeps everything in. It just sits down there. So you have more volume in the gut, and then it causes the bloating, it causes the discomfort, and then you're farting, you're crampy, and then you feel unwell, you can feel unwell. So that's what you have with lactose intolerance. And some people have it as well in the gluten sensitivity as well, which is the celiac disease. So again, similar stuff as well. Your body just cannot break down the gluten sensitive to the gluten, and then you get the same symptoms as well with the bloating and feeling uncomfortable, and then you have diarrhea as well. So diarrhea is basically you've got those substances that are staying in, they're keeping the water in because they're drawing in the water, and you get diarrhea as a result of that because the water cannot go out of the system. And strangely, I'm sure for those that have had lactulose before. So lactulose is one of the laxatives we use. It's essentially sugar. So again, it's just to encourage the body to draw in the water into the gut and help you to move your bowels. So it can be a double-edged sword, the sugar being in the bowels. So other things that will give you bloating. So I've mentioned the intolerances. I've said about the small intestine bacterial overgrowth in the previous slide, but also our menstrual cycle again as well, which unfortunately women, we can't do anything about it. It's one of those things. So some people around their periods, they get part of their premenstrual symptoms is bloating. They just feel a bit, things are not moving the way they should. One thing that helps bloating is exercise. Again, comes back to that physical activity, because once you start to do your exercises, once you start to move more, you have better blood supply, the gut movement is better, it pushes out all that gas, and it makes you feel better as well. You can use medications as well, so to calm down the stomach. So people use Buscopan, which people buy over the counter, or they can get medications from their GP to help with the bloating. Obviously, bloating can be a sign of more serious conditions as well. So if, I would just say just go and see your GP, and then they can do what they need to do to make sure if it's a bloating that, they just manage, or bloating that needs further treatment as well to treat. Now, what are red flags of bowel disease? So again, the gastric tract is such a long tract, as we said, coming all the way from the mouth all the way outside. And it can come up with all sorts of symptoms, but there's some things as medics we call red flag, i.e., when we hear them, we're going for more investigations. We're not messing about. Now, starting from the top, pain or difficulty swallowing. So pain or difficulty feeling like your food is sticking in your throat, or it's painful when you swallow, that is a red flag, and that needs to go get investigated with a camera test. Persistent vomiting, or blood in your vomit. Blood anywhere. I always say, look, when you're seeing blood, apart from women who have periods, we don't expect to see blood otherwise. It needs to be investigated. So blood anywhere, as a rule, we need to know about it. We need to then decide, is it the one that we think is a red flag, or is it one that we don't think is a red flag? But blood in your vomit, or blood in your stool, both of them will need to have more investigations for. Weight loss is another vague symptom. Is it from the stomach, or is it from other things? Now, again, you will have more investigations to decipher which it is. But unexplained weight loss, i.e., you're not trying to lose weight, but you're losing weight, is a worrying symptom, and it needs to be investigated. New bloating after menopause. So it's very, with IBS, irritable bowel syndrome, is a problem that usually occurs in late teenage years, 20s, maybe early 30s. But when you get into your 40s or in your 50s, very unlikely you'll develop IBS. So if you come with IBS and like, oh, I think I've got IBS, I'm just going to see how it goes, I would say you need to get that looked into quicker than I would tell a 20-year-old to do. But essentially for postmenopause, bloating is one of the early signs of ovarian cancer if you get it after menopause. So if a woman comes and she's past menopause and she tells me she's getting bloated, she's going to have all the full works, no questions asked. We get the investigations done first, and then we decide what happens after. And any new gastric symptoms after 55 years, again, for us, that's one of our guidelines, because it's been found that most of these new symptoms that occur need to get investigations for. And what are investigations we do? We usually do blood tests, and we do stool samples, and then we'll send you for a camera test, which we call endoscopy. It can go either from the top or from the bottom, depending on what part of the gut we're worried about. Now, this is the last slide. So I just thought I would add this here because this is very important as part of any bowel talk, just the awareness about bowel cancer screening. It's a free screening, obviously, organized by the NHS, so it's done centrally. This is not from your GP. This is a central NHS public health initiative, and that's for people from 50 years upwards. And it's a very quick one. It comes in the post. Please do it. Don't leave it, because it can pick signs of cancer early. So that's the end of my presentation, and thank you all for listening.
Wonderful, 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 wonderful. Thank you so much, Dr. Folake, again, for a very, very educational, very informative talk. A road through our bowels. Thank you. We had a guided tour. So now it's been, and I think it's really, really interesting because it's such an important organ. It's so important to almost everyday life, and we have to make sure that we know what we need to know about it. So we've got some questions. Let's have a look and see. So so some of them you've addressed, but I will just go through some again. Are there any medical explanations for unexplained constipation, which has led to hemorrhoids, despite high fiber diet, exercise, sufficient water, and healthy lifestyle?
No, sometimes the body does things that we can't explain. And once you've had all the investigations and you've done a camera test, you've done the stool sample and it's normal,
Yeah.
it's just one of those things that even happens in kids as well. Kids that we get see a lot of kids who just have constipation, and it's just that functioning. Maybe it's a form of IBS, IBS constipation. Maybe it's just the body is just not moving things, or that regulatory system has to taking out the necessary thing is not just right. What I will say, I'm thinking maybe it's not the right thing to say on a public health presentation, is we're generally more worried about diarrhea than constipation, generally. So constipation, okay, yeah, we do the investigation. Diarrhea, we're really more worried about it because it usually is a sign of something a bit more sinister. Constipation is just the gut is slow. That's all.
Yeah. And I think it'd be interesting to know what the person means by unexplained. So, because sometimes patients come and they can't explain it. I don't think that's what we're talking about. So what we're talking about now is you've engaged with the healthcare professional, you've had the conversation, you've done whatever's necessary, and at that point, it's unexplained. And just like Dr. Folake said, there's a concept in medicine that we call idiopathic, meaning it just happens. We don't know. And for me, it's another it's a humbling thing because everybody's like, oh, well, doctors are so smart, and we're like, we've done the study, we've done the work, but God is in charge of everything, and there are things that we can't explain. Okay, another question. What are the 3 things or supplements you would suggest to do or take for gut health? And again, I know you mentioned it in your talk, but if you were to summarize it, 3 things that everyone should do or take to improve their gut health.
So I think the main thing is the fermented food. I think that's the one that, well, maybe it's the big thing now, I don't know, but there's more research and there's more noise about it. Personally, generally, I do not talk a lot about supplements. There's lots of, things out there that people use. I just say eat sensibly, eat balanced diet, eat good nutritious food, and most times you'll be fine. You don't need anything. If you have any problems with absorbing things, so some people have like natural problems absorbing vitamins like vitamin B12, then yes, go for the replacement for that. If it's not a medical problem making you unable to absorb things, you shouldn't really need to have supplements. Your balanced diet should be enough for you. Eat healthy and that should be fine.
100%. I saw this meme and it had fruits and vegetables, and it said, this is what your pharmacy should look like. And I like the concept that in terms of maintaining health, I believe that all the things that are in the world, there's something that will help us in our body that God created. Okay, so you need fiber, you need this and that. And thank God for pharmaceutical industry and things to help us supplement. But the primary thing, typically like Dr. Folake says, how can I incorporate this into my diet and eat it naturally and have it as a tablet? Another question here. Any advice for individuals with looser stools, as in type 5, besides reducing spicy food?
So reducing spice is a big one.
No one wants to stop eating
Yeah, I know some people who go to parties with their spice in their pocket. I won't name names. It didn't say not to eat spice, to be honest. It said high spice intake. So, you're allowed to take your spice in your pocket.
Yeah.
But fiber is another one. So fiber is a good one there, because it helps you to the stool solidify. It probably is a form of IBS you're dealing with here if you've had all the investigations done. So you can then use medications to slow down the bowel a little bit. So there are medications available that you can discuss with your GP and they can give you those ones.
The other thing is, I think it's worth bearing in mind that everything that we call normal in medicine is in a standard deviation. So it's just the majority of people. For some people, type 5 is normal, and that's just their normal. It's every day.
True.
Some people, when they come to me and say, oh, I've had diarrhea, they mean type 7 stool 10 times a day. And some people say, oh, I've got diarrhea, and they mean type 4 stool once a day or twice a day. Like, so there is some, variance in what people are talking about. So, absolutely, if it's a worry for you, have a conversation with your GP. And again, once we do all the tests, because it might just be it's more a nuisance than a pathology.
Yeah.
We need to bear in mind. And I think this leads on, you mentioned about fiber. What's the easiest way to get enough fiber in your diet?
So fiber will really be your vegetables and your fruits. Those are the very common ones. So you want to avoid smoothies because apparently that breaks down the spice. You want to eat it whole. Smoothies are good, but you're dumping a lot of things into your gut and you're losing that essential fiber. So fruits and vegetables are your not will be my number one go-to. But you also want to go for whole grains as well. So whole grain is another good way of getting fiber. So we're talking about your brown bread, your brown rice, your oats as well is another one that you can get it from. Potatoes with the skin on, you want the skin on if you want the fiber as well, so you're not losing that. Beans as well as is a good one. I know there's some Nigerian diets where you remove the peel of the beans and then or you process and you blend. You won't get your fiber that way. You want the whole grains.
Absolutely. And a lot of and again, I'm Nigerian as well. A lot of some of the food that we have in the Western diet and the way that it's cooked and processed has fiber in it. So I mean, I would always encourage people do some research. I remember a couple of years ago there was a lady doing the health hour, and she was a pharmacist, and she was talking about researching into the health benefits of what we call home foods. You know, because often when we think healthy, we think other people's food. But
Yes.
there's lots of health benefits in the food that we are traditionally familiar with, and maybe we adjust the salt or the spice or whatever. But there's lots of health benefits in the food from where you come from.
Yeah,
Okay.
really, really important, absolutely important. And there's so many people that are doing that now, which is great. There is Hiba, I don't know if the Can team know her. She's
Yeah.
a dietitian, she's a PhD holder as well, and she's into diet. And I was doing this presentation, I was thinking, I remembered, and I was thinking she probably needs to come and do a session here. She's
Yeah.
Ghanaian.
Yeah. Okay. Another question. This is an out of the blues constipation. Okay. Blood work, food sample, and sigma to be done, but nothing found. Can perimenopause disrupt things in the digestive system? I mean, we know that.
Yes,
That's it.
yeah. Perimenopause it slows you down,
Yeah,
absolutely.
indeed. We don't have any other questions yet. So, I mean, I always like I think we've kind of addressed this, but just if you were to say, like the one thing that you would say, okay, everybody, in terms of your gut health, do this one thing, and do this consistently. That would be helpful for you. What would you advise?
Um, I would say have one meal that you eat mindfully.
Mm,
We eat, but we don't eat, a lot of times we don't eat mindfully. So have one meal so you know this is yours. So I know some people eat my breakfast.
yeah,
And I sit down and I eat my breakfast and I'm happy. And think that sets you up for the day quite nicely. And if it's your dinner, that's what it is. And for me, that's my one thing really. If you want me to pick one.
yeah. We've had some people talk about kombucha on the chat. You mentioned kefir, and again, I think there was a time when these sorts of things were um, inaccessible, or you had to know where to get them from. But because economies of scale and people are making noise about it, you can actually go to. What did I see? I saw. Uh, um, I saw I'm pretty sure it was pounded yam in Tesco or something like that. Like we
Yeah,
would never have seen it 10 years ago, 20 years
yeah,
ago, but the world is moving on. So I think it's
absolutely.
important for us, and yeah, I think I'll leave you guys with this. Dr. Folake has done a wonderful, wonderful presentation about gut health. Please send it to everybody that you know. Watch it again and make some notes and say, I will do this thing and I'll do it consistently, for 6 months, 12 months, because your body is yours and you have responsibility for making sure that it is as healthy as it can be for as long as it can be. So thank you again, Dr. Folake.
Thank you
Always
so
a wonderful
much.
time spending time with you. And I'm going to hand over to Ashanti to close the session.
I want to say thank you so much as well to Dr. Folake and Dr. Ayo. It was an absolutely amazing session. I personally have learned a lot about my gut health. So I just want to quickly share with us some different notifications and so on. Are you guys all seeing my screen? Okay, that's good. So our health hour, we run it every Saturday at this exact time. It's going to return again next week. We are so grateful to our doctors, they give up time and volunteer to do this work, and we really, really hope that everyone can consistently join in. Please do join in next week. We're going to have an amazing session on cataract, and that's going to be with Dr. Mensah. It promises to be something really good. Share as well with anyone you think is going to benefit from the session. Also, we are running our Greater Manchester Black History Month Civic launch next month in September. Please do reach out, register, get involved. It promises to be a really amazing event. There's going to be a lot of different performances, a lot of different talks, and a time to basically come together, I think, and celebrate Black history and heritage. Please don't miss out. QR code is there. And again, please do share within your networks, share with people who might be able to make it. Equally, we at Khan offer confidential and culture appropriate support. So if you need support with any of these things on the slide, domestic abuse, and sexual abuse, we offer advocacy as well. We offer home office, if you have any home office issues, we offer help around that. And legal drop-ins are also available. So again, the helpline is, apologies, I'm running too fast. The helpline is there. Please do take the number. We've also got an email, contact us, QR code as well. We also offer BHIP, which is a training program. It's across Enfield, and that's in London. So that's a borough in London. Again, please do share to your network if you feel like anyone would be able to benefit from this, because as it says too often, we have patients with similar symptoms, but those outcomes are differing because of race. And I think getting our clinicians to become more culturally aware is always something good. So please do sign up. QR code is there. Equally, we at Khan really do want to emphasize the importance of giving blood. It's never been easier, as the slide says. It's quick, a lot easier than you think. Your QR code is there. Again, please do book a slot, look into it. It absolutely can change lives, save lives. And it's a lot easier than you'd think. Additionally, again, we at Khan do offer Black-led counseling services. And we basically do have tailored counseling. If you yourself know a registered counselor or are a registered counselor, do also get in touch. But we can make referrals for yourself or someone you know. Again, please do email. The email is there, and also we have the QR code as well. And so thank you everyone for joining us. Again, we hope to see you all next week.
Joined us on Zoom, Facebook, LinkedIn, or YouTube. Thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.